Thank you, Billy and Jerry. Amazing. That was fantastic. My name is Kristen Angel. I'm the Associate Director of Advocacy at NORD. Working in patient advocacy, I've had the opportunity to see how impactful it is to advocate for yourself and for your health, including your mental health. A rare disease diagnosis is often accompanied by an array of physiological and psychological challenges for both patients and caregivers. In this next session, we're going to hear from Maggie Adair from a caregiver perspective, Kyle Underwood, a patient perspective, Jody Taub, a licensed social worker with both a patient and professional perspective. They're going to share their firsthand experiences, strategies for coping, and skills to help those living with rare conditions live meaningful and impactful lives. Thank you. Come on up.
Good morning. Our journey with the rare disease community began far before we ever knew it existed. We were living on the Central Coast in California. My husband and I were a busy young family. We were working full time, and we had a busy and active toddler at home. In the fall of 2017, we found out we were expecting. We went to our 20-week appointment to find out whether we were having a boy or a girl. We left that appointment being told, in no uncertain terms, you have a week to decide if you'd like to terminate the pregnancy. That appointment changed our lives forever. All because of a single measurement that could potentially be serious and have extreme conditions. My life after that became a series of follow-up ultrasounds, echocardiograms, and testing, none of which produced any positive results. Olivia Josephine Adair was born on July 7, 2018. She was bloated, never cried, and was breathing but not well. They pulled her from me immediately and began working on her. It would be 4 hours until I got to see her face. It would be another 3 days before I got to hold her. That week for me will always be one of the most difficult in my life. She would spend a week in the NICU. 2 days after she was born, I was discharged from the hospital. I thought for sure they won't send me home without her, but they did. It was as if somebody had carved a hole out of my chest. A part of me was missing. But a week later, she came home. They pulled the monitors and tubes from her, and life more or less returned to normal. She slept a lot. That first year, I think that's all she did was sleep. I had to wake her often to feed, and even then she didn't feed very well. I returned to work in October. It wasn't until her 6-month appointment that her pediatrician, Dr. Hutchison, became increasingly concerned about her. She had missed several milestones at this point, and she had been hospitalized several times with respiratory illnesses. I always like to tell people she was either healthy or hospitalized. There was no in between. I will always give her pediatrician, Dr. Hutchison, so much credit for the role she played early on in Olivia's life. My husband and I were exhausted. We had been through multiple tests since that 20-week appointment. Each test was a breath of anticipation in and a sigh of disappointment out. We had no results. And frankly, I was tired of looking for something we may never find. But Dr. Hutchison looked my husband and I in the face and gently yet firmly said, "Please do me this one favor. Please go to the neurology and see what she has to say. If nothing comes of it, we'll let it rest." So we went to neurology. Of course, it only took us 6 months to get in. I think the neurologist spent all of 5 minutes looking at Olivia. She looked at her belly, her back, her arms and her legs and her toes, and she said, "Well, there's nothing I can do for you. You're going to have to go to genetics." So we went to genetics. In July, we went up to Stanford University and met with the genetics team. Of course, they ran their own tests, but it would be multiple weeks until we got our results. A few weeks after that appointment, I woke up with some interesting symptoms. My skin felt like it was on fire. My limbs were so stiff, I couldn't move. And I had nausea so bad, I couldn't eat. Very quickly after that, I only can explain it as being the deepest, darkest depression I have ever known in my life. I spent the majority of most days laying in bed or on our couch, sobbing. I was so unhappy, but I had no idea why. I had 2 beautiful daughters at home, a husband who loved me, and a wonderful career. Yet I was so unhappy. Funny thing happened, though. About a week later, we got a phone call. It was Stanford University. We had our results. Olivia was patient number 55 of a rare genetic condition called USP7. It was so new, they didn't even have a real name for it at the time. She is now one of 135 patients with what has just now been named Howe-Fountain syndrome. If the search for a diagnosis broke me, her diagnosis saved my life. It validated everything we had gone through leading up until that point, since that 20-week appointment. My husband and I began to process everything we had been through. For so long, we had been surviving. If it had been just one hospital stay, just one test, just one NICU stay, we probably could have gotten through it. But it was hit after hit after hit that really did a number on my mental and emotional well-being. So while we had time to process everything we had been through, we also had to start processing what Olivia's life was going to look like now that we had a diagnosis. She wasn't going to be the same child we had envisioned her to be. We had to, in a way, grieve the person she wasn't going to grow up to be. A few weeks later, we made the difficult decision, my husband and I, for me to quit my job. And about 6 months later, we made an even bigger decision. We decided to move our family across the country to Charlotte, North Carolina. Living on the Central Coast in California, we did not have access to the health care that we were going to need. We lived in a rural area, and while it was beautiful, there were not the opportunities and choices we wanted for our daughter in her therapies and in her specialists. I have been through a lot these last couple years. My family has been through a lot. And it has taken me several years to get back to who I think I am. It has taken many therapy sessions, some medications, and the infinite support of my family and friends. I still have to think consciously some days about my mental health and how I'm moving forward. I have to check in with me from time to time. But through all of it, my husband and I, we've become better at checking in with each other as well. I'm happy to share that Olivia is thriving today. She just started preschool this year, and as you can see, she started with a walker, and she ended the year walking on her own. When thinking on the topic, resiliency while rare, I don't believe we wake up one day and all of a sudden we're resilient. I think it's a process, and I think there are degrees of resiliency within each of us. The Maggie before Olivia arrived wasn't very resilient. I learned that pretty quickly. But we choose to be resilient in many ways. For us personally, we choose to be resilient by being grateful. I am so grateful for all of the people we have met on our journey so far, the beautiful individuals who I feel like I've known my whole life, but some I've only known for a couple months or a year. I am thankful for every specialist, every therapist we have seen who has shared stories with us, shared their words of wisdom, and especially those caregivers and specialists who have taken time out of Olivia's appointment to turn to me and say, "How are you, Mom?" That was when I knew I might not be okay, when Olivia's doctor was asking if I was okay. And on our really bad days, I'm simply thankful for the challenges we don't face, because some days they feel like a lot. We're also resilient in choosing to celebrate the milestones. I don't know if any of you are raising typically developing children alongside non-typically developing children, but there's something just a bit sweeter about the milestones reached by non-typically developing children. When our first daughter started walking at the age of 1, we were thrilled. As new parents, it was pretty cool. But when Olivia started walking on her own at the age of 3.5, I can tell you there wasn't a dry eye in the room, including her older sister, her physical therapist, and her dad who rushed home from work that day. And lastly, we're resilient by sharing our story. I will tell you, when we first got Olivia's diagnosis, I didn't want people to know. I didn't want to share our story, which is very unlike me. I tend to be an oversharer. But as a parent and a caregiver, you want nothing more than to protect your child and to save them from any potential danger or harm. I was afraid that Olivia was going to be judged, or that people would define her based on what they thought they knew. But I now know that in sharing our story, it has made us stronger as a family. Her sister took a book to school this year to share with her first grade class. She doesn't know all the details of Olivia's diagnosis, but she knows Olivia's a little different, and she was able to share with her 24 other classmates some of the struggles Olivia has gone through. In sharing our story, we're not only sharing understanding and empathy, but we're also giving Olivia a community to grow up in. We're giving her support, and we're giving us support too. While Olivia's hurdles and challenges are not over, we have certainly faced our share. She is resilient, and she has taught us to be resilient too. Thank you.
Can you all hear me okay? Great. Well, thank you, Maggie. That was a touching and powerful story about the diagnostic journey, but also the importance of our caregivers in the community. Today, I'm going to talk about my own experience as a rare disease patient. For me, I think I like to start off as I'm Kyle Underwood, and I have a rare disease. However, I'm not my rare disease. Before we get started, I think it'd be helpful to kind of highlight my story and kind of where I came from and where I am now. At the age of 4, I was hospitalized for 5 days with an eye infection. And it just so happened that a geneticist was rounding the patients. My parents thought, normal child, developing fine, nothing abnormal. And that provider asked, let's do some additional testing. From that time, I was diagnosed with a rare lysosomal storage disease called mucopolysaccharidosis 2, also known as Hunter syndrome. At that time, there was actually no current treatment or cure. And my parents were basically told, take your child home, give them the best childhood you can, and just kind of wait. And I think back to that experience and see what my parents went through. There's two routes they could have gone. They could have gone to hope and despair, or what they chose to do instead is fight and advocate. So throughout my childhood, I was exposed to a lot of opportunities, a lot of experiences where, I was able to be involved in sports. I was able to go on and be involved in school. And I have to say it was challenging because there's a lot of people saying, no, you can't do that. No, you shouldn't be in the normal classes. No, you shouldn't be playing on the baseball field. But my parents said, no, he will. He will. He will. In 2009, I was able to start a weekly infusion called Elaprase. And that led to me being able to now live a life of somewhat normalcy and be able to do the things that I do today. As I looked into my adolescence, I think that's where I started to begin to realize where my disease may be different. I started to notice I was short than others, my stamina wasn't there, it was hard trying to make friends, and I began to understand why me, why is this wrong with me? And I think in that moment, it was a balance of what makes me different and how I want to be like everybody else versus what makes me different and how can I make an impact with that. When I went on to college, that's when I really began to understand that I could take my experience and my perspective from being a patient, going to countless doctor's appointments, medical surgeries, and weekly infusions, that I could really take my story and make an impact in the space. And as you can see in the photos, I think it's important to highlight that family, friends, and just, my own successes are part of my story and something that I'm very proud of. I think as I look to my story now, one of the biggest things for me is how do I cope with the challenges I face? I went to college, I had a great experience, and then I went into the work field. And through all that, again, there was these no's. No, we cannot. You can't do that. No. But I had to find out what that yes is. And I know for all of us, a rare disease and a diagnosis is painful, it's emotional, it's a sense of despair and loneliness. But I was able to lean on others, friends, family, and a great support group in the rare disease community to understand that we in the rare disease community have value, we have worth, and we can make an impact. And I think for me, one of the things that I began to realize is, as Simon Sinek says, is, finding your why. And as a patient, I think oftentimes we're so inundated with these medical definitions and medical terminologies where they're always trying to tell us what we are. But the true reality is we are all singular person, and we have a why and a purpose of being here. So with that, I was able to understand, listening to others, leaning on others, beginning to understand where I can make an impact and a purpose was my way of coping for my disease. As I look back, I think it's something important to say is perspective is reflective. I think it's okay to understand that we all have a diverse perspective. We all have something to share, but it's also important to reflect on those experiences and reflect on those times where you may be feeling a sense of loneliness, a sense of sadness, because that only makes you become that person. When I look to the future, I think one of the things that I've always valued and cherished is that when you begin to understand other people's perspectives and the value other people bring, you're more likely to become a more inclusive community. And for me, when I didn't share kind of where I'm at now, but I currently work at the Cleveland Clinic as the program manager, which is something that, 10, 15 years ago, I would have never thought I would be able to do. And it all came from the people that value the perspective that I brought to the table. And I think something that has been very important to me is when I look to how do I cope, how do I deal with the rare disease, is that while we may all be different, there's a lot of similarities we share. We have grit, we have drive, we have been challenged to our wits' ends, and we still are able to get up every day and keep moving forward. And I think, Maggie brought up a good point. It's like, what does resilience, mean to me? And resilience isn't a one thing. You wake up one night and you're, no, I'm a resilient person. It's a series of experiences and encounters and perspectives and values that you build over a long period of time. And once you begin to understand how important that is to not only you, but others' journeys, you're able to make an impact. I think something that is really interesting with the rare disease community is, we come into these diagnostic journeys looking for a definition. We get this definition, and that gives us hope. But I also want to encourage you all to be, in a world full of definitions, be undefined. Because we don't all want to be the same. We all want to make a difference in our own way. That's something I've leaned on. I'm Kyle Underwood, and I have a rare disease, but I'm not my rare disease. My rare disease allowed me to make an impact in areas that I don't think I would have been able to do if I didn't have the rare disease. And I think once I accepted that fact and that truth, I was able to be successful in my endeavors. And I have to underscore it all that it's not every day is easy. Not every day is, roses and sunshines and rainbows. But knowing that I'm able to make an impact and create a purpose in someone else's life in the rare disease community allows me to keep moving forward. So I encourage you all, as you look, parents, physicians, patients, to find that why and find that purpose and lean into it. And as you begin to have struggles and become, overwhelmed, make that be your true north, because that'll allow you to get past those hard times. Thank you.
Thank you both, Kyle and Maggie. That's a tough act to follow today. So, my name is Jody Taub. I'm a licensed clinical social worker, and I have, hold on, I'm gonna move on over. I have a private practice, and I specialize in chronic illness and rare disease. But I think more importantly, I'm a rare disease patient. So I wear two hats today, but I'm with you on both fronts because I think it's really important to understand that our experience is unique and it's different. And in a positive way, our uniqueness bonds us, and I'm thrilled to be here today with everybody. One of the most important things that you can do in building resiliency is to build resiliency through coping, but through support. And you took a great first step today, and it might have been your third step today to show up and to be here amongst other people who live with chronic illnesses, different types of rare disease, who get it. You may be a patient, you might be a caregiver, you could be a sibling, but we're all here together. So rare is resilient. I use this slide to talk about some of the positive things that come from living with a rare disease. Often we focus on the deficits. What can't we do? What are the modifications of things that we need to do to try to live a normal way of life? But in doing all of that, we build a certain skill set. And that's where resiliency comes in, is going through difficult times. And just like Maggie and Kyle said, this is not easy. Nobody's signed up for this. But it's what you make of it. And it doesn't mean that you don't go through difficult times, but over time, learning how to become more capable. Emotional support. When we focus on living with a healthcare condition, most of the focus goes to managing the healthcare condition. It's managing how you feel, making sure you attend appointments, making sure you're managing your insurance or your medical care. But often we don't talk about how emotional support goes hand in hand with managing the physical support. If we don't have the mental health support resources and the emotional support from our community, it makes it a lot harder to manage. So a couple points that I want to make today about how to get that emotional support. So explore talents and interests. Making sure that you maintain a full life, even though you have a full plate and lots of things going on, is important to making you feel that you can cope with your everyday, to cope with the rough times, to cope with the flares. Make modifications so that you can attend events. Big modification today, everybody's wearing masks today so that we can feel safe and comfortable, and for those of us who need a little bit of extra protection. remind others of what you can do. Often when we're having conversations with people, we talk about the things that we need, that we can't do, that are a little bit harder for us. But I think it's important to remind others of what you can do, because it's also a reminder to yourself of all the things that you can do. Connect to family and friends and your peer community. This decreases isolation and enhances connection and understanding. There have been many studies recently, and some are posted on my slides today, that one of the most important parts of a better outcome and a better way of life for those living with rare disease is to make sure that you have social and community support. Make sure that you reach out to family and friends. Make sure you reach out to others who are willing to have a helping hand. And peer community, we're all here together. And it's really important. I know that there's many of us who have rare diseases in this room who've never met someone else who has your rare disease. But we're all in this together. And so whether you're a part of a rare disease community that has many patients, or you're part of a rare disease community where there's fewer than 20 patients, reach out to those around you. The rare disease experience itself has similarities as well. Participate in work, school, and social events as much as you can. This can help you to feel that you're living a valuable and purposeful life and can help reduce symptoms, anxiety, and depression. Just like Maggie was talking a little bit about the dichotomy between who she was before her daughter was born and who she was after, managing a rare disease can be all-consuming. That could be your full-time job, whether you're a caregiver or whether you're a patient. And it's really important to remember to strike a balance, that these other things that make us who we are, as Kyle had mentioned earlier, he's not his rare disease, also make us who we are. And we have to prioritize doing other things in our lives that are meaningful. I call them taking mental health priorities or mental health risks to make sure that you're living a valuable life. In addition to that, when our life becomes small and all we're doing is managing our illness, it can lead to anxiety and depression. And as Maggie was talking about a little bit today, she was crying, she felt despair, she didn't know how badly she could look around and say, okay, I have this wonderful family, but I'm still depressed. And I'll get into this a little bit more in my presentation today about clinical symptoms of anxiety and depression and some resources in dealing with it, because it is a part of the rare disease experience. Validate, advocate, and educate. Living with a rare condition means dealing with the inability of others to appreciate how the condition impacts you. This can feel isolating and frustrating. Using these moments as a teaching opportunity to spread the word to validate your experience. How many of you in this audience have had people say, but you don't look sick, or, right, raise your hand. It's a very different experience to have a disease that other people cannot identify. They don't know the course, they don't know what it looks like, and that creates a level of responsibility on us to try to get support in a different way. We have to explain to others what this disease looks like. So instead of someone knowing, hey, wait a second, you might be going to chemo, or for you, you might need insulin, or you might need a cane and walker, people don't understand what those modifications are. And because of that, they may say things that are hurtful, or they may not offer help or know how to offer help. Use these experiences, use these conversations as a moment to tell somebody else about your rare disease, to talk about it, to advocate. That's where the resiliency comes in. Hey, by the way, I do all of these things to live with this chronic healthcare condition, or to take care of my child or my loved one with this chronic healthcare condition, and I do all these other things too. It helps you by telling your story. Telling your story is such an important part of this process. And I encourage you, even when people say hurtful things, to tell your story, to advocate. Say, no, actually, this is how it works. Because every time you tell somebody about your story, you're building education, you're building community, and you're building understanding, because that's what we need. And that's a huge part of our process that we often do not receive. Prioritize mental health. I'm going to say it 2 more times. Prioritize mental health and prioritize mental health. Most of us, when we go into a physician's office, it's very rare that we ever talk about our mental health. We don't talk about when we're having clinical symptoms, and we don't talk about how managing our mental health is just as important as managing your physical health. If you're managing your mental health, then it makes it easier to be able to manage all of the tasks at hand. It provides you with a level of flexibility to manage case management, to manage flares, to manage not feeling well, to talk to others about what you need. But when you experience anxiety and depression, or I'm thrilled that there was a speaker today who talked about medical trauma, which I will talk about a little bit today. It allows you to manage these things so that you can better manage your physical health. So I'm going to talk about some practical coping tools, and all of the resources that I provide today will be available by NORD. So if I go through the screen a little quickly, don't feel the need to write it down. So I'll talk about mindfulness and meditation resources, mood trackers, and mental health resources, which are professional mental health resources. So mindfulness and meditation resources. And before I get into the practical coping tools, this is not a one-size-fits-all. I encourage each of you to take what you need. And if you like one thing, great. If you don't like another practical coping skill or tool, then use something else. It's individual basis, there's no pressure. So with Smiling Mind, Insight Timer, and Headspace, those are all great meditation resources and mindfulness resources. We know through research that mindfulness-based stress reduction, which is MBSR, and mindfulness can be helpful for patients who are living with rare chronic healthcare conditions. Books, so if you are not an app person and you like books, I've listed a couple books today that are helpful about coping with chronic healthcare conditions by using mindfulness. So one is MBSR Daily Practices from the Heart of Mindfulness Based Stress Reduction. John Kabat-Zinn is the founder of mindfulness, and his work was actually based on living with chronic healthcare conditions. And then Mindfulness-Based Stress Reduction, the MBSR program for enhancing health and vitality. Mood trackers. I highly recommend giving a mood tracker. Everyone in this room will understand how a mood tracker works. You do a scale. In the same way that you go into a doctor's office and they tell you to do a pain level scale of 1 to 10 to kind of see where you're at for your flares. What mood trackers do is they do the same thing for you from a mental health perspective. So it'll help you to identify negative thought patterns, examine automatic thought, and identify triggers. Sometimes in our daily lives, we don't understand that a series of stressors may be leading to our mood being off, and then it can affect how we're feeling about our relationships and how we're going through the day. And it helps us to take a step back, take a look at what we might need to do, and then intervene when possible. So I'm going to talk about some professional mental health resources. So there's lots of different professional mental health resources, but I'm going to get into some of these today. Talk therapy, so that's the traditional sit on my couch, tell me your problems. There are different types of talk therapy that are helpful for rare disease and chronic healthcare conditions, and this is also based on research. ACT, which is acceptance and commitment therapy, cognitive behavioral therapy, CBT, mindfulness-based cognitive therapy, and mindfulness-based stress reduction. These are different modalities. But I say in this room today, all mental health professionals are trained to deal with mental health. It is difficult, as the speaker was touching on, I heard in the last of the Q&A, it can be a little bit difficult to find, it might be difficult to find a provider in your area who copes with chronic healthcare conditions, so we want to make sure that you find somebody. It's best to talk to somebody. All mental health professionals are trained with anxiety and depression. If you are going to go on psychotropic medication, I highly encourage you to find someone who uses Genosight and Genomind. And 2 weeks ago, a study came out that you have better outcomes by using this. It is a DNA process. You can get it sent to your home. You can look on both of these sites for a provider in your area who does it via zip code. And you get a DNA swab and find out which psychotropic medications are right for you. Psychotropic medications are based on a variety of different healthcare conditions as well, and mental health and psychiatric care has become much more advanced, and it will lead to better outcomes and less symptoms of anxiety and depression, but also potentially less side effects, and making sure you get the right dosage. The last thing I'm going to lead with today is how to find a therapist. It often can be very difficult to find a therapist because your physician might not know someone in your area. You may not feel comfortable sharing that with a medical professional or friends that you know, because mental health is personal, and sometimes people don't feel like sharing that. I recommend using Psychology Today Therapist Directory. It's the largest database of therapists in the United States, but what's helpful about it is you can put in keywords like chronic illness, you can put in your insurance, your area, and find providers in your area who might be right for you. These are some mental health resources which will be available via NORD, which are just some associations and magazines, journals, and articles. And lastly, those are my references. So thank you so much for having me here today. Rare is resilient.
Thank you so much. We are going to kick off Q&A. The first question is, how can I communicate my needs for support from others in my life?
I'll take this one. Can you guys hear my microphone? Okay, great. So I touched a little bit on this in my presentation, but I'll go a little bit deeper on this. Look for people's strengths. Everybody provides support in the way that they think they would provide support. So it's helpful to ascertain how people can be supportive and who may be supportive. So you might have people in your life who are really good at taking action. So they may pick you up from an appointment. They may be willing to take your child or walk your dog or provide a meal for you. And then there's other people who are really comfortable with emotional support, and they may be the person you call on the phone to vent. So think about who's in your life, how they can help, and then communicate to others what you need, especially in the rare disease space, as I talked about earlier. Many people don't know how our disease manifests itself, how our flares work, and what we need. So let them know what you need.
I can add on to that. I think something we like to talk about a lot is situational leadership in the leadership realm. And I like to say that situational support is something that has been very important to me. So in certain settings, let's say you're in academia or you're in a work setting, your support's going to look differently. And for me, I had to accept the fact that I need to be open around my story, but also make sure that it's in a way that's understood by my colleagues, my fellow classmates, versus if I'm talking to a family member or friend. And like Jody said, finding where their strengths, where their alignment. So what I've been done is really framing my story in a way that kind of matches those strengths and those understandings to be able to kind of get that, I don't like to say the word buy-in, but more of a mutual understanding. Because if I were to say to a colleague or someone in school, something that might be very emotional, very deep, it might not be received as well as if I was talking to a friend or a family member. So being aware of that as well has been very helpful.
Another question is, what are some tips for managing flares or bumpy roads?
I'll start with this one. So something that I realized through my experience was how closely related my physical and mental health were. So something I now do to manage, to kind of, instead of react, kind of think ahead. I am very conscious to work out about 5 days a week. It keeps my stress, my body from getting too worked up or anxious. I also am mindful to talk, like they said, to certain groups in my life. So we do have a closed Facebook group of our rare genetic condition. Thankfully, one of the early patients decided to create an organization. And so I can talk to other parents if I feel like, we're heading into rocky roads, or if I'm struggling, I tend to reach out to those parents because they either have been where I'm going, or that maybe they're on their way there. So we do have a group of kind of toddler-age kids that I'm tracking, and the parents and I talk quite often about what we're seeing with our kids, symptoms, things like that. And then in the day-to-day, again, I know who I can turn to and talk to just to talk, just to kind of release, a valve release, if you will. And those are not always parents of children with rare diseases. Sometimes they're just my friends, and they are just good listeners. So that's how we kind of manage our flare-ups and our tough times.
I have a question addressed to Jody. Jody, are there specific mental health resources for rare disease? And what is a spoonie?
And what is a what?
A spoonie. Earlier we talked about the spoon theory. Are you familiar?
Oh, okay.
Yeah.
So yes, if you guys go actually to my to one of the slides that I had today, I do list some of those rare disease resources on there. So I would refer to that. I'm glad everybody asked about, or someone asked about spoon theory. It's a fabulous theory. There was a woman who had lupus, and she came up with a way in which to talk to other people about what it's like to live with a chronic healthcare condition. So the basis is that people who are healthy have an infinite amount of spoons. So they can go to school, and they can go to work, and they can take care of their children, and they can do the laundry, and they don't get tired. But for us, we have a limited amount of spoons. And so let's say we have 10 spoons that day. If you use 1 spoon for medical appointments that day, or 1 spoon for not feeling well or for work, when our spoons are out, our spoons are out. That's all we have. And so by using this theory, it gives us a language to talk to other people, a language to talk about how we may be feeling with the people that we love and what we can do, so that we aren't seen as tapping out. So it allows you to be able to have a language, a conversation, and I encourage all of you to Google that today. Google spoon theory, and you'll see a lot of the information around it, and people who are part of the chronic illness space use that terminology. And then you can learn about it and teach it to other people in your lives and use that for communicating.
Thank you. I'm hoping Kyle can take this one. As a patient with a rare disease, what coping methods have you found to be most effective?
Yeah, I think for me, it's kind of evolved over the years. I think starting off, it was really just taking that time to pause, and I don't think I understood what reflection was when I was a teenager, but really taking that time to pause and, validate what I'm feeling, and then having someone to share that with. And for me, it was a really great close friend as well as a family member. But then as I got older, I think what became to be helpful was being able to share it with a larger group, and then understanding how I could take my story and use it to make a difference in others' lives. And so I think a lot of it for me is reflection, taking that time to just really think through it, and then speaking to others that are in the rare disease community but also are not. And then with that, seeing where are my strengths and what can I bring value to, whether it be the workplace, school, community. I'm also very, I have a strong faith background. That's something that's been very important to me. But again, it comes back to taking the time to pause, reflect, and see what strengths and value you have in your journey that could then go help others. 'Cause I think a lot of times we have a rare disease and we feel like, we're always seeking help for ourselves. But ultimately, once you're able to give back and help others, it's a really fulfilling thing, and realizing that you have value is something that I've done.
Okay, thank all 3 of you. Let's give them a round of applause.